Alrighty, guys, welcome back to the show. Today, I have a very special guest, somebody that is a fellow podcaster, if you will, somebody that I reached out to on Instagram, along with so many of the guests that I bring onto the show out on a whim. And, I just really appreciate you taking the time tonight and coming on the show. So without further ado, David, what's going on, my man? How are you?
How you doing, man? Yeah, thanks for having me on.
Absolutely. So, man, let's kind of keeping it true to the podcast, if you will. I love taking people back and sharing their story. So tell people, I guess, real quick what you currently do, and then we'll kind of take you back in the past there and kind of take you through the story of your life.
Sure. So right now, full-time job is as a dentist. And, this kind of side project of mine that's become, actually pretty time-consuming, but in an enjoyable way, is this podcast. I call them like charity interviews, basically have people on, and it's all health and fitness related for the most part. But for all of them, we donate to charity. And then that is up to the guest, as long as it's a reasonable charity, I allow them to choose, and then I make a personal donation there. But that takes up a good, probably 15 to 20 hours a week for me. And then I have my full-time job going on along with that.
Wow. That's really, really cool. I wasn't even aware of the charity aspect of it. That's awesome.
Yeah.
I haven't heard of anything like that before.
Yeah, I actually hadn't before either. When I first started this, it was back in September. And, because as there's a lot of podcasts out there, and I wanted to make sure it was worth it, and I'm enjoying it. So for me, it's already worth it. But I just thought okay, let's say I do all this and, not that many people watch it or it doesn't take off. I still wanted it to do something for people, and obviously I hope the content helps people. But even aside from that, this way I have a personal donation to every charity that's mentioned, and then we'll put a link in the description on YouTube. So if people like the idea, they like the charity, then they can click on the link and make a donation themselves.
Wow, that's awesome, man. I love that. I guess I missed that when I was kind of stalking you here on Instagram, but dude, that's amazing. So how did that, I guess before we dive into your story, how did that whole idea kind of manifest?
For the podcast or the charity aspect specifically, or just all of it?
For both. We'll start with the podcast.
Yeah. So over the summer, I was finishing up my residency, and I actually reached out to Eric Helms, and we had talked one time prior to that. But I was just telling him look, man, I have a bachelor's in health and exercise science. My doctorate is in dental surgery. And, I've always had this passion for health and fitness, and it kind of feels weird now being out of that setting. And I was talking about what do you think about the idea of getting, a master's in it, which, some people might find that strange if you already have a doctoral degree going back for a master's. But actually Lane Norton and I talked about that as well. And he's actually thinking about going back and getting a master's too. But in any case, he thought he was yeah, that's cool. And then I was watching Steve Hall, Revive Stronger podcast, and I was seeing a lot of people he had on. And at some point I just thought to myself, man, that's actually really cool. Oh, and actually watching Joe Rogan too. Obviously a little bit different type of podcast, but I just thought this is a really cool thing where you're not just having to make content all the time as far as your own personal content. Not that there's anything wrong with that. And I do make separate videos myself, but some of the, let's say fitness YouTubers, I will see make the same video over and over and over, over maybe 5 years, they've made the same video 10 times. Whereas when you have these interviews, you can talk to different people constantly and learn from them. And I just thought that was a really cool thing that would be fun for me. So I just decided to start on my own. And then, as I mentioned before, as far as that charity aspect, I just thought that would be a good way to make it all worth it, even if it didn't take off. And it's had pretty good reception so far. So I'm pretty happy with it.
Wow, that's awesome, man. So I'm always curious, when I talk to other podcasters out there, what do you remember, what the first podcast was that you listened to?
The first one I ever listened to,
Uh-huh.
It would have had to have been one of the fitness ones on YouTube. I wasn't huge into podcasts, but I'm trying to think the first one. I really don't know. It's probably somebody who's not even really doing podcasts anymore, to be honest. The turnover rate, I think, with podcasts is pretty high.
Yeah.
So I couldn't tell you. I could tell you it was probably one with one of the 3DMJ guys. It was probably Eric Helms or maybe Alberto Nunez, one of those, as far as them being guests. But I don't know who would have been the host for it.
Got it. Man, so I'm just so curious, your whole background and how all this manifested. So let's take you back. So where were you born and raised?
So I was born in Princeton Hospital in New Jersey, and I spent most of my life in New Jersey, pretty much like central Jersey, about 20 minutes outside of Princeton, until college, actually including college. And then I ended up going to University of Maryland for dental school.
Got it. Got it. So tell me, however much you're open to share, tell me a little bit more about you kind of like in those elementary school days. Like what type of kid were you growing up? Did you have brothers and sisters, only child? Like what did that dynamic look like?
Yeah. So, older brother, a lot of competition there. Younger sister, just more like protective of her. And it was good having the older brother because, I mean, he got to a lot of things first before me. But I was actually, we were like similar size. I was kind of a fat kid, which definitely is what got me into all this in the first place. And he was like the kind of stereotypical lean kid. So, we get in fights and, just, get into different sports and stuff like that. So that brotherly competition always kind of kept me athletic. And then, like I said, I was overweight. And so I always remember thinking like I wanted to have abs. Like that was just always this thing for me. And I eventually took it too far in the other direction. And I ended up getting really skinny. And I remember my freshman year of high school, I was 5'11" at the time and like 130 pounds. So I was very, very skinny. Yeah. I remember my grandfather like yelling at me, telling me I needed to put on some weight. So yeah, I mean, definitely even from a young age, I was into like the whole like body image thing and maybe to an unhealthy degree. But I was extremely goal driven, not just with fitness stuff, but just in life, if I wanted something, like I was going to get it. And that's kind of followed me through life, with different aspects and goals I've had. So at times it's maybe hurt me, but for the most part, I'd say it's helped.
Yeah. So yeah, I mean, it definitely can be kind of a double-edged sword, I could presume there. But what were you, I mean, thinking back to it and like knowing that you had these like, I mean, I guess body image issues at such a young age, like was there anything other than like, I want to have a six pack? Like, was there any other like external factors that you think affected you?
At that age, not, I guess, so much. I mean, of course, I think like most guys, like they want to look good for girls to some degree, right? I remember kind of having like an ego and like pride that wasn't my reason. I remember thinking like, but I think even then it was because like I read articles that shouldn't be your reason. You know what I mean? Like when I was like 13, it's like, oh, you got to do this for yourself. But I'm sure, the compliments I got from girls that, oh, I was looking better and things like that helped. So I guess that would be more of like an external motivator. But for me, it was just, I don't know if it was like an ego or pride thing. I just remember always like seeing like really impressive physiques and wanting to look more like that. And probably to a delusional extent, before I really knew about the reality of lifting, I remember thinking like, you know what, I want to be 225 pounds at 10% body fat. And, just looking at guys on T Nation and stuff like that, I was like, yeah, like I'll get that in like 5 years. And, obviously reality set in at some point. But yeah, for the most part, it was just seeing those like crazy physiques and always wanting that and kind of wanting to have that impressive appeal to other people. So it was definitely external for a long time.
Yeah. Yeah. No, I hear you, man. I was the same way. I think a lot of us were. So
Right.
what about like on the driven piece there you mentioned? I mean, obviously like you're a dentist now. I mean, like where did you get that drive from and kind of that mentality of like, if I want it, like I'm going to get it. Did that come from your parents or what do you think that came from?
Yeah. I mean, to some degree, I actually do think that is just somewhat genetic. And by that, I mean, you look at like the, big like 5 traits and conscientiousness, and you look at parents versus kids, and a lot of times it does seem like there's some heritability there. My dad, actually both of my parents are very much like that. When they say they're going to do something, they do it. And I really like that. I really like people that I can depend on in that sense that like, if you say you're going to do something, you're going to do it. And I don't have to worry about you doing it. It's just going to happen. And they were kind of always like that with goals too. I mean, I think back to my dad and like, before I was even born, he was, full-time job at like an airport. He was going to law school. He just had his first son. He was running another business. I mean, there was just so much stuff going on, but he just made it happen. And I guess he just kind of instilled that in me that like, when we say we're going to do something, we do it. And even like with school, I mean, he definitely pushed me, he kind of like the stereotypical, like the dad pushes you, the mom is just like always supportive of everything. And they're both good at different times, but he definitely kind of like pushed me to I guess, be like the best that I could, which I appreciate, you know, looking back on it. Like I never felt like it was like too much. It was always a good stimulus for me.
Yeah, that's awesome, man. Yeah, I mean, I think I talk about it all the time. It's like I got my work ethic from my dad. I mean, he was more of like the blue collar worker, if you will. I mean, he was getting his hands dirty. I mean, still to this day, that man works so much. But
Yeah.
you know, I respect it. Like I definitely got the work ethic from him. So I love that. So where did this whole like process? I mean, you mentioned probably like through the middle school, high school years, but like when did you start looking at the magazines? Like when did you start working out, lifting? Like when did when did this like passion of like nutrition and fitness and all this manifest?
Yeah. I mean, honestly, I always used to say when I was like 10, because that's when I started losing weight. I remember because I wrestled, and I remembered being like, I don't know, I was shorter, obviously. I'm like maybe like 125, and whatever height I was at that time, that was like kind of chubby. And I remember like having to lose weight for wrestling. But even before that, actually, I was just on, do you know Abel? I think his last name is pronounced Saibai, his podcast. I was just on his, and he was kind of asking me a similar question. And it was interesting because I remember when I was 8 years old and like running around the park, like doing laps. And there was this like older couple walking by me. And I remember the husband saying, "Oh, I wonder when he'll stop." And then the wife said, "Oh, I'm sure when he gets tired." And even at 8, I had this like prideful moment in my head of like, I'm already tired, but I'm going to keep going. So, I mean, it was pretty young, and I don't know like why that started, but it was pretty young that I just like had this drive to kind of push myself physically. But as far as really lifting, probably when I was like 11 or 12, you know, just getting into like push-ups and stuff. Even like in middle school, I remember like arm wrestling was like a big thing back then, you know, among all the guys. And like, I just remember like taking pride in like beating everybody in arm wrestling. You know, it's like weird stuff back like that. Just kind of that like competition among, I guess, like other boys like at your age, you know?
It's like the alpha male.
Yeah, pretty much, man. Like there was definitely like a sense of pride for it. And even like, I remember there was this kid who was a lot heavier than me, and I beat him in arm wrestling. So I just assumed back then that meant I was stronger than him, like all around. And we did like a tug of war at like, you know, some like outside event. And I was like so shocked that he beat me, even though he was like 50 pounds heavier than me. Cause I just thought like, wait a minute, I could beat him in arm wrestling. How did he beat me? And like, you know, at that time you just have no gauge for like anything basically.
Yeah. So what sports were you playing in high school there? Like talk about, I mean, like I guess talk about kind of the academic side of it and then also kind of like the sport side of like your high school career.
Yeah. So, I mean, before high school, I played like pretty much every sport. You know, I mean, like a lot of kids, you try everything out. So pretty much like every sport you can think of. And then once I got into high school, I kind of narrowed that down. So I tried swimming actually for a year, hated it, like really did not like it at all, and wasn't good either. Did wrestling, which I enjoyed a lot more. And then I played tennis too. And, you know, athletics in high school wasn't a huge thing for me. I mean, pretty much every year I was playing a sport, but it wasn't like this is my whole life. This is like everything I'm doing, because I had already really like caught the bug for lifting at that point. So that was really my passion. And then the sports were kind of just around that, you know, if I could fit in the sports with my lifting and my cardio and stuff like that. But it wasn't like a huge part of my life. And then of course the academics, because I mean, from an early age, I mean, probably my sophomore year, I already knew I was either going to go to med school or dental school. So I already knew I had to like spend a decent amount of time on school getting good grades. So it wasn't like sports were like a huge part of my life.
Got it. That makes sense. So what, like when you were transitioning from like high school to college, how did that whole process go for you? Did you have like different schools you were choosing between, or were you kind of dead set on the one you went to, or?
Yeah, not really, actually. It's never really been like a stressful thing for me applying to schools for college or for dental schools. So when I was I guess it was right after my junior year, I ended up going to Harvard for just like a few credits just to see. I mean, it was just like a great experience. It was an international program. And so that made me like consider applying to some Ivy Leagues for like my full-time college career. But my dad had gone to the College of New Jersey, it was called. And so it was a pretty good school, and it was getting better every year. You know, like the rankings and all that were going up. So I just applied early admission to that. I got in, and I just that was the last thing I thought about. I didn't really have to stress out too much with applications.
Yeah, that's awesome. Because a lot of people, well, maybe not with like undergrad, but like dental school, especially, I'm sure get pretty stressed through that process.
Yeah.
So maybe taking it back real quick, because I think that this is relative to you now and kind of everything you went through. Do you remember back, like in terms of sports, like were there any athletes that like you grew up kind of like watching and just like falling in love with? And like, was there any athletes like that for you?
Like professional athletes?
Professional athletes, yeah.
You know, not really anybody specific. I know like my dad, you know, he's a huge sports fan, or I think he was more so, a little bit less now. And he had me read a book on Joe Namath, and I remember like that kind of getting me into it. And again, kind of going back to the physique thing, I remember seeing the physiques of the athletes and thinking like, damn, like I really wish I could look like that. But I wouldn't say there was like a particular athlete where I was like, this person inspired me or anything like that. Maybe even more so probably the athletes I would see around me, you know, like when I was a freshman and I would see like the senior wrestlers and think like, damn, like how do I get like that? That was probably a bigger inspiration for me and a drive for me than maybe the professional athletes who I don't really have much of a real connection with.
Got it. Yeah, that makes sense. It's interesting that it seems like you were kind of more interested in the physique, like you said, rather than like the performance. So like more of the aesthetics than the performance side.
Yeah. I mean, I always liked being stronger for sure. So performance in that regard, yes. And also because I was stronger than I looked, you know, I don't think many people would look at me, especially back then, and say like, wow, like, you know, it's so impressive. But some of my lifts, they definitely did think that, especially relative to how I look. So from a performance standpoint, I did focus on strength and I enjoyed that, but it wasn't like I was trying to be, you know, the best possible athlete that I could or anything.
Yeah. Did you like compete in powerlifting, or was it just kind of more recreational, or?
I had considered competing in powerlifting for a while, especially when I was in dental school. I was pretty strong, and that was probably like my peak strength. I remember looking, I don't remember if it was USAPL. I was looking into an organization that was like pretty big, and I remember like seeing the 198-pound category and thinking like there was a good chance like I could have had a record there, like for the class that I would have been in. But it was just like peak dental school time. Like I was very busy. I had a job in dental school. I had never competed before, so I'm sure like the first time I would have had, you know, it would have just been a bigger process having to buy like the equipment for it and everything. And honestly, I just kind of just let it go. I remember like the idea of maybe getting like a record was very cool. And looking back, maybe I should have done it, but I haven't actually competed in it.
Got it. Yeah, I was just curious, but I was lucky enough in high school, we actually had a powerlifting program. And
Awesome.
so I'm down here in Texas, and our powerlifting program was actually probably bigger and like more popular than our football program, which is saying a lot.
Wow.
Coming from Texas. But yeah, you're right. The gear is expensive. I think I had like $1,000 worth of powerlifting gear.
Oh, damn.
Between everything. But we actually sent like a kid in every single weight class to state every single year. So it was a big thing at our school.
Yeah, that's awesome, man.
So in terms of like Eric Helms and like all of these different, you know, I would like to say like famous people in like the fitness space, like how did you like, I guess who was the first person that you came across, and like, I guess what prompted you to just be so interested in all of this? I mean, even till today, like knowing that you're a dentist, but yet still you have this podcast, like how, like, have you put much thought into like why I guess you have this passion project on the side that's completely different from what you're doing?
Right. Yeah. I mean, it is definitely different as far as it being like completely different. I've always had a passion for health too.
Okay.
And so while these are certainly different, there is some commonality in as far as like, you know, I've always been interested in improving my own health, and then, you know, clients' health or patients' health. And so in that regard, like even just today, I had a patient who was talking about how she had thyroid issues, and she was telling me about how she was on thyroxine and Cytomel. And you know, she was very impressed with my knowledge on it, but really my knowledge on that was not from my dental background. It was actually from, you know, this kind of fitness world we're in, because I've looked into that myself, and I kind of am interested in endocrinology. And so it's not that they completely tie in, but sometimes they do have this crossover. So a little bit of that, but then just in general, I mean, I do like what I do a lot as far as like my career. But as far as like my true passion, it has always been the health and fitness side. And so I reached out, like I said, I reached out to Eric maybe last summer. I don't know if you know Scott Stevenson, but he and I have talked for probably 4 years now. So we go pretty far back. And those are the two people I first reached out to regarding the podcast. So it's just been a good way to keep me interested in fitness because, I mean, it's not like I see myself stopping anytime soon because it's already been like 15 years. But having this, it definitely keeps me more involved in that world. And it becomes less, just going through the motions and more like, okay, who can I talk to about this stuff? I have some friends I guess you could say like in real life friends that are interested in fitness. But even then it's more like they go to the gym. It's not like they are really like delving deep into these like nitty gritty details. And that's something that I like being able to do because even just being able to like nerd out with somebody like Eric Helms, where it's like, I don't have to stop and explain what I mean 5 times over the half an hour, I mean, if anything, he's got to stop and explain things to me, so, and I do like that. I like being able to kind of have that content back and forth.
Yeah. That's awesome, man. I love that you say that it all, kind of goes together, and you're right. I mean, it's like when I sit here and think about like dental health, I mean, obviously that plays a big role in my health. So maybe let's actually transition to that a bit because I'm curious, like knowing that, I come from like what we're all about is like nutrition coaching. Can you talk about kind of like nutrition specifically in regards to like dental health?
Yeah, sure. And I mean, don't get me wrong. Like, I'm very aware that most people probably aren't like super interested in dental health. I mean, it's definitely not as sexy of a topic as, like how can I grow my arms or anything like that. But obviously, it is important. And, the more studies that are going on, the more they find that dental health is related to systemic health. And I mean, if you look at people who have periodontal disease, there's significantly higher rates of diabetes. I mean, it's like an inflammatory condition. And so, I mean, generally speaking, so other areas of your body are likely to be inflamed, if for no other reason than the correlation, right? I'm not necessarily saying that periodontal disease will cause every other problem, but you'll see somebody who has periodontal disease, they're probably not taking care of a lot of other things. But there are actually like direct correlations and causations, even like when they look at the bacteria that's found in the mouth, and then they look at some people who have like infections in different valves of the heart, they find that it's the same bacteria. And so oftentimes people who have had dental treatment done when they're in a bad position, they will find that other markers improve in their systemic health. So again, I won't, try to like oversell it and act, like we're the most important doctors or anything out there. But there obviously is an importance to it. And I personally have become more interested in it over the years. When I first got into it, I'm not going to act like I was so passionate about teeth. And from the time I was 6 years old, I just wanted to be a dentist. It wasn't like that. But the more I've done over the years, the more I have actually developed a passion for it.
Yeah. Well, I mean, honestly, I think it's one of those things where it's like, maybe it's not interesting to a lot of people because they don't have a problem. But once they have a problem, then it becomes very interesting. Like, I mean, I think about, I was just at the dentist a few days ago, and I have a problem of like grinding my teeth at night. And so I have like a mouth guard, and, I wear that because they tell me, they're like, if you don't wear this, like, when you're older, like, I mean, you're going to literally just grind your teeth all the way down. And that's scary because that could lead to a host of other problems. So I think for a lot of people, I mean, it's almost like, a chronic disease or something. It's like, it's not a problem until it's a problem, Right.
Yeah. I mean, any, like specialist you would go to in medicine, you're probably not really thinking much about it until it hits you. And actually you just maybe think with the bite guard there. So we will sometimes treat patients with sleep apnea in dentistry, and, we'll make them different mouthpieces. It kind of opens the airway, allows them to breathe easier. And I've had a few videos now on sleep apnea, but how it related, because some people were saying about neck training, and they were saying, does neck training cause sleep apnea? Because obviously if you're a thicker neck, that's one of the risk factors for sleep apnea. But that, again, it's just somewhat tying in my background in dentistry with health and fitness in a different way.
Yeah. Well, I mean, I think honestly, you're serving your clients so much better. I mean, we hear all the stories about clients going to doctors, and doctors, they maybe have 5 minutes with their patient, and maybe they're not having the time to go into these details and answer questions or whatever. But I mean, if I went to my dentist and I was having conversations about thyroid, and I would be like, oh my God, like this is legit. Like I would feel so much more confident, and not only you as a dentist, but just you as like a health practitioner.
That's the goal. Yep.
Yeah, that's awesome. So, if we transition a little bit here into kind of like, I guess, the nutrition and fitness space, like, I mean, even knowing that you're a dentist here, like, what are some of the conversations that maybe you hear from patients in the dental office? Or I know you do some work working with clients remotely as well. Is that right?
Correct. Yep.
So what are some of the most like common questions that you're getting?
Honestly, and I'm sure you know this from coaching people, it's and actually I think I just heard, who was telling me this. Somebody was saying like one of the things in the fitness industry is you have to get used to saying the same thing over and over and over again. And that's why I can almost sympathize with somebody like a Lane Norton or a Lyle McDonald when they get frustrated with people, because they've both had situations where they've had these controversies. But like, man, when you've said the same thing for 10 years and people still don't get it, it can get frustrating, right? And so a lot of times it's just getting people to understand, what's actually important, to not freak out about these small details, and to just be consistent. I mean, honestly, like half the time that I'm doing like a consult or something, it's just getting this person to realize like, look, you're focusing on all this, but you're doing this major problem. Until you finish or like fix this major problem, it doesn't matter what else you're doing, because it's just canceling all that out anyway. Or, hey, I can't get to the gym on this time. This time I'm going once a week. Well, it's like, okay, well then you don't need to know about advanced periodization. You need to get into the gym at least 3 times a week before you even start talking about that, So the biggest problem I would say is just people being consistent and focusing on the right things, which is very commonly a problem.
Yeah, I completely agree. I always talk about, I don't know if you've read the book, The One Thing, but, I always talk about, it's like, what's the one thing that's the movie forward? Like everybody's so caught up in all these little details. I like to paint the picture of like, if I took like a mason jar and I had you pick like your 5 big rocks, right? And then from there you filled it with pebbles, and then from there you filled it with sand. So like if you were to define like what your 5 big rocks for like the majority of the population needs to focus on, so that could be like sleep, nutrition, exercise, like what would those 5 big rocks be for you?
For like life success, or for like fitness goals specifically?
For like health in general, any, like just all aspects of health into one.
Yeah, I mean, I guess it depends on how broad these categories can be, because I mean,
they can be broad, very broad.
Yeah, well, if they're very broad, then I would say pretty much exactly that. Sleep, exercise, nutrition, and I would say some form of either like meditation / quiet time. That is something that I think is generally missing from a lot of people. Just something that you can kind of relieve stress. And man, that's like that's pretty much everything. I mean, I'm happy to get into more specific details too. But even just those, like we were just saying, if you're focusing on these tiny details, it's really, those are like the big concepts. And I don't think anybody has all of those, really completely down. We're always trying to improve, but I know some people who are maybe freaking out about, I mean, just like the smallest things, but they're getting 4 hours of sleep. And it's just like, it doesn't matter what you're doing, you got to focus on that one thing. Like you said, the one thing. So those would be the biggest ones for sure.
Yeah. Well, and it's so interesting with sleep, right? It's like everybody comes, they're like, what supplement should I take? And you ask the question on sleep, and it's like, look, sleep it's free. Like it doesn't even cost
Right.
any money, right? Like, but yet you're neglecting it. It's the same thing with like staying hydrated and like, not sitting down all day, like actually walking, keeping the step count up and stuff like that. So, yeah, it's an interesting conversation. The 5th rock, though, I talk about a lot on, and I think this one's talked about even less, is the whole idea of like the importance of like relationships and like human connection, doing what you and I are doing right now. I mean, for me as like an entrepreneur, like these 3 or 4 times a week that I do these interviews is like the best thing for me, because it's a lonely journey. I'm at home by myself all day pretty much. So
Right.
like, do you ever talk about that with clients, like the human connection piece, like the relationship piece, like the power of like, getting involved with like a community?
I personally don't, but I think it's a really good point. I guess when I have people come to me, I am focused more on like specific fitness goal, but if you're talking about like general life happiness, life success, I couldn't agree more. I mean, first of all, even if from a purely selfish standpoint, it benefits you to have relationships. I mean, people who have positive relationships in their life and a lot of, close relationships, they have lower rates of depression. They tend to live longer, just better health in general. So even for that reason alone, you should try to, make friends, but also generally when you have good relationships, you're helping out other people, right? Most people think about what were the best experiences in their lives, it's almost never this one time I was alone doing this, right? It's like when I was with my family for this vacation, when I was with my friends doing this. I mean, it could even be some type of work, but doing that with people. It's very rare that anybody would describe the best experiences of their life when they were just alone, right? And so for like a generally happy life and successful life, I'd say relationships are huge, above a lot of the other things.
Yeah, absolutely. Yeah, those are like just some of the pillars we talk about, and then it goes back to the clients. It's like from there we'll start filtering some of those pebbles, some of those maybe less as important things, and then the sand is like the stuff that's just in the that are popping up on CNN each day or whatever, and
Right,
everyone's
right.
asking about. So I want to tie this back just because you're a dentist, and I've actually never had a dentist on the podcast before, so I kind of want to take advantage of that in a sense. Is there any like just advice that you would give people like for dental health at all? I mean, I honestly, for me, even like I never really thought about it or prioritized it or thought it was like of importance, except for the fact that my mom told me I needed to like brush my teeth when I went to bed and wake up. That's
Right.
probably all the education I got on dental health. And that's probably the same for a lot of people,
Yeah, and I mean it is. And so the thing is, like, one thing that's nice about the podcast I'm doing, and somebody else asked me if I ever think I'll try to make fitness a full-time profession for me. And I said probably not, because I mean, for one, it would be hard to replicate the same lifestyle that I get from dentistry, but two, I like that I have both, right? I like that I can go from one to the other. If I'm tired of one, I can kind of focus a little bit more on the other. But a third benefit is that I don't like ever see the need to like kind of like sell out and like push things that I don't believe in, right? Like I don't think you're going to see like a Dave Maconi supplement line anytime soon. So I just, one, I don't think supplements are that important, and
You're not going to make a probiotic.
you know, and it's just like in general, I think there's so many of those. Like if I think a product's good, I'll recommend it, but it's just not worth it for me to like do that sort of thing, or push a specific routine. Like if somebody wants to come for my help, I'm happy to help them. But basically I'm just saying that it's nice that I don't have to like push things or do the same video 5 times in a row or anything like that. So the reason I'm mentioning that is from this whole dental health thing. You will find some people who they will push the importance of something to the nth degree, right? I mean, you'll get these people who, oh, adrenal fatigue is everything. And so, you got to focus on that, or gut health is everything. And this is all we're going to talk about. And it's the key to everything. I think you've had Gabrielle Fundara on, right?
Yep.
And I really like her.
Actually bringing her back on again, and we have a whole podcast dedicated to probiotics. So that'll be fun.
Yeah, and she's great, but she'll be the first person to tell you that this is not magic, that you can make some great improvements with your gut health, but it's not the solution to everything, and she would know more than almost anybody else, right? So when it comes to dentistry and dental health, I say it's almost like, look, like if the entire world like brushed and flossed as they should, most people wouldn't have a problem, right? They would be fine. In the same way, I guess you could say if everybody exercised well and ate well, they probably wouldn't see their doctor more than, maybe like once a year. But some people don't do anywhere near that. And so they're chronically ill, right? And so dental health is really important, and like really poor dental health can cause huge problems. But for most people, if you're just doing the basics, you're fine, right? We could get into small things as like, are there benefits to fluoride? And there's some controversy with that. And, what foods are going to make you less prone to getting cavities? And obviously, you could talk about sugars and acidity and all that. And I can go into those details. But I think for most people, they have a generally good idea of what they should be doing. Don't drink 2 sodas and then go to sleep without brushing your teeth, right? Like, it is, I think, fairly basic as long as you're on top of it. And so I don't want to like oversell it and try to sound like it's, this cool, exciting thing. it can get bad. And I've seen some really, really bad cases where, I literally have to take out, every tooth in the mouth and start from scratch because there's just so much, disease going on. But most of us, thankfully, are not in that position and hopefully never will be. So it is important, but if you just stick with the basics, you'll probably be fine.
Yeah, man, I love the way that you kind of map that out and compared it, because it is so similar. It's like we tell people, it's like, work out consistently and eat healthy consistently. I mean, it really is kind of the same with the dental health. It's like, make sure you actually brush your teeth. But I guess one question I would have is, like, let's say for instance, I mean, because the recommendation is maybe brushing in the morning, brushing at night, and then flossing at both of those times, right? So
yeah, maybe floss once a day, but yeah.
Or once a day. Okay. So what if, like, you chop that in half? Like, what if people were doing what you said, and maybe they were, for whatever reason, like they were just going to bed at night, they were being lazy and they weren't brushing their teeth before they went to bed. Like, what if they did that every single day? And I know you can't give exact numbers here, but like, how long would that take to catch up with them, do you think?
Yeah, definitely can't give exact numbers, and not just because like I wouldn't want to, or I'd want people to, start acting a certain way. It's just, it is honestly genetic to some degree. And it's the type of food you're eating, right? If you're eating, let's say, a ketogenic diet and you have almost no sugar in your diet at all, right? So you're not really going to be providing a substrate for the bacteria Streptococcus mutans to really be causing cavities in your mouth for the most part. And so if you go to sleep after that, probably not a huge deal. If, on the other hand, you're eating a bunch of candy and going to sleep, that could catch up to you very quickly. So diet is actually going to have a huge impact in that case. Genetic predisposition to that is going to have a big impact. Whether or not you had fluoridated water and just use fluoride in general is going to have a big impact. So your teeth have what we call hydroxyapatite crystals, and the pH that basically cavitation will occur is higher for that than if it's fluoroapatite, which is what happens when you have fluoride. And so the critical pH, for people who don't know, a higher pH is more basic, a lower pH is more acidic. And so the critical pH of the hydroxyapatite would be maybe like 5.5, versus for fluoroapatite, it's like 4.5. So basically what that means is you can afford more acidity in your mouth before cavitation occurs, right? And so you'll see some of these people who are maybe older, they grew up without fluoridated water, and they are much more likely to get these cavities than maybe this younger population that had fluoride and had sealants and things like that. There's a lot more preventative measures nowadays as well.
That's interesting. Yeah. I mean, I just think about even me and my own parents. Like, I've only had one cavity in my whole life. Mm-hmm. Like, my mom has really, really good teeth. My dad does not. And so I guess I got my mom's genes. I don't know. But yeah, that's interesting. So what about on the flossing side of it? Because even though everybody says that, yes, you should floss, like, there's a lot of people out there that aren't flossing. That's for sure. So like, what happens if you're not flossing? Like, why is that important?
Yeah. And I mean, again, that's even debatable. I mean, I certainly am not like the best with it, even myself. Realistically, I probably floss like 2 or 3 times a week. Hopefully I don't lose my job for that. But I think most people are not doing it every day. Again, are you having taffy that's going to stick between your teeth, or are you eating something that, and also even like, how are the contacts between your teeth? Is food getting in there or not? I do think it's important. I've seen like a study or two showing that there wasn't a huge difference between people who did and didn't, but most people who floss don't even do it correctly to begin with. They might just go down rather than going against the teeth. If I just use anecdote, I would say most people I know don't floss, and it's not like they're just running rampant with cavities in their mouth. I do think it helps, but again, I'm not the one who said this, but I don't think it's like hugely critical that you need to be flossing every single day, but I do think it is beneficial.
Yeah, no, that makes sense. And I appreciate your transparency on all this, by the way.
Yeah. I mean, again, I just don't want to like oversell it. I understand like what we're teaching people and what should be done. And the thing is, that's the thing. If you tell people you got to floss every day, they'll floss every couple of days, right? If you tell them, you're probably fine with once or twice a week, it turns into once or twice a month, right? So I definitely understand the message, and it's not even that I disagree with it. I just think, again, if you're doing, the majority of things right, you're probably going to be fine.
Love it. Awesome, man. Well, Dave, I appreciate you letting us kind of dive into the dental stuff here towards the end. I didn't know if we were going to get into that or not, but hopefully that was some useful tips for people. But dude, where can everybody find you at? Your website, social media, your podcast. Where can everybody kind of reach out to connect with you?
Sure. So yeah, on Instagram, it is Dave_Maconi. Without the underscore, you'll just get my personal one, which really doesn't have anything on it. Facebook, you can reach out to me if you want. Again, not a ton on there, but a lot of people have reached out to me just to ask me questions on there. And then YouTube is Brains and Gains, and that's got all of the podcasts as well as, again, like individual informative videos that I make personally. And actually, we are now on the different podcast apps. So that is, I haven't made it like an official announcement for that, but in the last month or so, we have gotten onto the different apps.
Very nice. Very nice. And I have to ask real quick, how did the Brains and Gains, I love that name. How did that, where did that come from?
Yeah. So obviously, like intentionally corny. I just figured, so, obviously I kind of like the intellectual side of all of this. So the brains, but we got to make our gains. So my brother was actually pointing out a picture, and, a lot of all of the YouTube videos will have like the picture of me, and I've got like the dental lab coat and everything. And then a lot of times the people I interview, it's like a bodybuilding picture of them. And he's like, dude, like you can't even tell you lift here, and all these guys look huge. I'm like, yeah, like there's the brains portion and then there's the gains portion. So I think it kind of works out.
There you go. I love it, man. Well, Dave, thank you so much for taking the time, man. I could probably, ask you questions all day long. It sounds like you're a wealth of knowledge, man, but I want to respect your time. And yeah, dude, thank you so much for taking the time. And for those of you that have questions, reach out to Dave. And yeah, man, I'd love to stay connected, and we'll talk soon.
Absolutely, man. Thanks for having me on.